First of all, thank you very much for the opportunity to present our work today. In March, the Royal Society here in the UK launched a program called the Rapid Assistance in Modeling the Pandemic, which aimed to pair up academic research groups with data scientists in industry. And that was really to give more capacity and scope to the various research groups trying to tackle the questions around SARS-CoV-2. As part of this program, James Kelly and I joined a team at the London School of Hygiene and Tropical Medicine around Mark Jitt, Yang Liu, and Rachel Lowe. James and I have a background in statistical modeling and quantitative trading at IPM, and our background very much is based around statistical estimation methodologies, and that was a great fit for Mark and his team in trying to tackle questions. And in particular, the aim of this study is to think about the impact of non-pharmaceutical interventions on the reduction of the transmission of SARS-CoV-2. We had some excellent data sets which we could work and which underpin a large amount of our work. The first one is the Oxford COVID-19 government response tracker. The team in Oxford curated an excellent data set which catalogues the interventions by countries with different start dates, end dates, and also details the levels of intervention. These details are really critical because we can use those to infer the intensity of an intervention which a government is placing. And that is significant because we can tell if an intervention is at a local level or if it's at a national level. And also we can tell if it applies to a small group of people or to larger gatherings. The other good thing about the latest version of the Oxford government response tracker is that we have different categories which we can look at. A broad category around containment and closure policies, one category around economic measures, and the third one around health system policies and classical public health interventions. And the second main data set we use is EpiForecast, which gives us the time-varying RTs, which measure the in-population transmission of the virus. On slide 2 in figure 1, we show the evolution of the summary measure of interventions. And what you can do is all the different categories of measures can be summarized into one overall measure which tell you about the stringency of overall government policy. And what you can see is that across all countries globally and all continents, these do move, broadly speaking, in line. Unsurprisingly, East Asia was ahead in terms of increasing stringency in policy measures, given that the pandemic originated in the region. But then over March, we see a rapid increase across all regions. We don't really have enough sufficient data to model any individual country and to obtain statistically significant findings. But by using data across all countries, this gives us a much richer set of data with which we can work. What we do is we use panel regressions to estimate the effectiveness across all 13 categories of non-pharmaceutical interventions over the period of January to June of this year. The first step of this is to consider what the temporal associations between these NPIs are, and we use a hierarchical clustering analysis for that. And that comes in two separate cases. One is timing of any effect. As I mentioned before, we have the ability to look at intensity of the intervention. And what we model in the first case of any efforts is as soon as a government does anything in a particular category, and that could be closing schools, that could be contact tracing, that could be testing policy. We assign a 1 to that, and if a country doesn't have any measure in place for a particular category, we assign a 0. And what we can see here is that if we look at that very high level, then all the interventions split into 2 significant clusters. The first cluster is around classical public health policies, such as contact tracing, testing policy, and public information campaigns. And then the second cluster is around all the containment, closure policies, and economic policies. This makes sense and is a natural way for the NPIs to cluster, because public health policies are typically the first measures governments take to contain the spread of a pandemic, and these are also in many ways the easiest things to implement. The second thing we can look at is the timing of maximum efforts. And what we do here is we look over the time period and say, what is the maximum amount of intervention which has happened in a category? And then we assign a 1 to the time period that maximum amount of intervention happened, and zeros otherwise. And in that case, we obtain 3 significant clusters, but not all measures actually fit into one of those clusters. And this makes sense, and that can be seen from the perspective that the maximum policy measure doesn't happen simultaneously across all countries, but actually maximum effort or maximum intervention is reached at different time stages between countries, and that leads to the differences we see here. Now, turning to the panel regression analysis itself, we are looking at the time-varying reproduction numbers Rt against the different non-pharmaceutical interventions. So the Rs are the RITs in the panel model we specify here, and the NPIs are encapsulated in the XITs.
5-minute warning.
Sorry.
5-minute warning.
Thank you. And we use a fixed effects model to model this panel regression. We examine different model specifications to account for various different things, namely temporal lags between NPIs and changes in Rt. We consider different levels of intensity, the time-varying changes in NPI effects, and variable selection. And from that, we can draw a number of different conclusions. There is strong evidence for association between school closures and internal movement restrictions and a reduction in Rt. And that is irrespective of the model specification we look at, but that comes through in all cases. Workplace closures, income support, and debt relief have strong effectiveness, and we can ignore the level of intensity on that, and that again has significant impact on reducing Rt. And then the third category of interventions which have strong evidence of effectiveness is public events cancellations and restrictions on gatherings, but that only applies in the maximum capacity in the most intense cases, and that is if you have restrictions on gatherings of people of 10 or more people, whereas if you have restrictions on 1,000+ people, that is not effective in what we have seen in the data. So some of the further interpretations which are noteworthy is that some of the interventions occur in certain sequential order, and that may actually have an impact on how we can capture the effects of those interventions and others. And this is an interesting area for further research once more data is available and more time has passed for us. The best fitting models also support a considerable delay between the implementation of interventions and the effect on the transmission rate RT. And we see that on average globally to be about a week. In Asia, it tends to be more 5 days to 10 days, and in the Americas, it's somewhat faster. And then the third point, which is worth highlighting, is that we are not able to really uncover evidence that the classical public health measures such as contact tracing and testing have an impact on the transmission rate. However, one should note that these are very different in nature from the containment and closure policies and the economic policies, and that comes from the fact that by testing and by contact tracing, public health officials are much more able to trace the spread of the disease and be able to have a much better picture of what's actually going on. So we can't, in the same classical way as for other measures, see a reduction in transmission, but that could be just purely of how we measure this.
1 minute warning.
Thank you. Our study extends the research which exists currently in a number of ways. I mentioned, and particularly that we look after at a very large number of countries and territories over a long time series. We look at variable selection in detail to find parsimonious models on that, and we look at the cluster analysis. With that, I'm happy to take any questions or to follow up by email or Zoom at any stage later on. Thank you.
I don't think it's quite time for questions, but thank you very much, Christian.
Thank you very much. Thank you.